Now, this may seem obvious, but there is a relationship between psychological stress and burnout. And this graphic, which you may or may not recognize, is from the US Surgeon General's advisory on building a thriving and healthy workforce. And if you look at each category, the point I want to bring home here, if you look at each category, you can see how our health system at every level is contributing to psychological stress and where distrust and psychological unsafety could show up. And I'll just let you just take a moment and you can see at each level, the societal and culture level, the system level, the organizational level, and even the workplace and learning environment. And at the end of the day, the sentiment is this is just beyond my control. Now, in preparation for this talk, I surveyed several dozens of physicians, and because I wanted to make sure to make it clear that this is not just some out there issue that is only happening occasionally and not really a global problem. These experiencing and occurrences are impacting physicians and healthcare professionals and workers widespread across the nation. Now, I'm a physician, so I'm in physician communities. I interviewed physicians. I know this is happening in nurse communities and the communities of social work, the communities of the community-based medicine, all types of workers. So I invite you, like I'll share a lot of physician stories, but I invite you to sort of map this on to whatever industry organization, type of organization that you're working through. And so when I interviewed Dr. R in preparation, she shared with me that she was working overtime and needed to slow down, but didn't have the space to say it. And when she got sick and she ended in the ICU, missed some work. And when she got out of the hospital, she was asked by her partners why she missed work. And when she told him that she had been in the ICU, he looked at her and says, "There's no way you're in the ICU." And this same doctor shared with me that while she was working at the same organization, that during a period of time, her house burned down and she lost nearly everything. And there was no acknowledgement. There was no condolences. There was no empathy. However, about a year later, when a colleague of hers had a house fire, there was an abundance of condolences, an abundance of cards and donations and empathy. And she said it wasn't really about him receiving these things. It was just the fact that when she experienced the exact same thing, no one saw her, no one acknowledged her pain. That sort of lack of empathy there. So psychological safety is also an inclusion belonging issue. There was a study done in earlier this year, in collaboration with the Commonwealth Fund by the African American Research Institute. 59% of healthcare workers reported stress associated with dealing with or witnessing racism and discrimination in the workplace. And 64% of healthcare workers worried about retaliation for reporting acts of discrimination either against themselves, against coworkers, or against patients that they witnessed. Psychological safety is a quality and safety issue. Okay. When I interviewed Dr. H, she shared that when she was a new physician, she noted that there was a longtime senior physician who was not observing universal protocol with joint injections. And when she inquired, not reported, simply inquired about whether this was a safe practice, not only was she reported by the senior physician, she was written up and investigated as being too aggressive, right? So this is a workforce issue, a well-being issue, an inclusion and belonging issue, a health equity issue, a patient care issue. And when people feel safe in those four areas, inclusion, learning, belonging, learning, contributor, and challenge, they feel safe to express themselves. They feel safe to explore, to connect, and to be vulnerable. They feel safe to experiment within reason, to be creative, to take risks, and just to be. So ultimately, when people feel psychologically safe, they feel safe to be themselves, without having to mask or having to code switch, without the background fear of being judged, ridiculed, humiliated, or harmed.